SCHWARTZ here, Literary Director of the Sun Valley Writers Conference, coming to you remotely while sheltering at home, as I know all of you are doing now as well. I want to jump right in with a conversation that we're bringing you under our new series of literary conversations, SVWC NOW, with my dear friend Abraham Verghese, best-selling author, physician, and professor of medicine at Stanford Medical School. For years now, in indelible books such as My Own Country and the novel Cutting for Stone, Abraham has written with incredible empathy and insight, and with great knowledge of the lives of both doctors and patients. His is one of those voices that I consider necessary during such times as these. Abraham, welcome. Let's just jump in, shall we? It's great to see you, my friend. How are you?
Thank you. I'm well as can be. I think we're all beginning to feel the effects of being sheltered for so long, even though perhaps I'm a little less sheltered than most. So it's been a stressful time for all of us, I imagine. So this is a wonderful a relief in the course of my week to get to talk to you and to think about literary matters. So thank you.
Well, you have a lot more to think about than certainly most writers I know, most people I know. Medicine is a calling that I know you hold sacred. And as a physician and a professor working every day in one of the country's major teaching hospitals during the worst public health crisis in decades, I want to ask you what developments you're seeing on the front lines now that are causing you most worry.
I think on the initial stages of this epidemic, it was very worrisome because the lines of transmission weren't all that clear. And I think it was very clear that you had to impact people's mobility and freedom and personal freedom in order to impact this. And we were fortunate in that Governor Newsom took the unusual step of shelter in place in our county and 6 other counties well before it became a California-wide thing. And I think it spared us the brunt of this. But nevertheless, it's been somewhat shocking for me to see what proportion of patients who come in who are thought to have this infection and then confirmed to have it wind up being in the ICU. So the proportion of very seriously ill patients, at least from the perspective of a hospital, has been quite striking. So they don't fill up your regular wards because when they come in, if they're that sick, they typically wind up in your intensive care. And so having to mobilize those resources. And then the great bottlenecks that have emerged of the bottleneck of testing, not being able to know that this person has it is so reminiscent of the early days of HIV when we didn't even have that word HIV because we didn't know what we were dealing with. But this is not the case here, where very quickly science ramped up to tell us what it was, and we had a test, but just couldn't get it available in large enough numbers. And then the big difficulty with personal protection, an institution like ours, as I think I may have mentioned to you, we use 23,000 masks a day normally.
It's incredible.
2 major hospitals and all our clinics. So you ramp that up 10 to 20-fold, based on one directive, you can run out of your resources in no time.
Mm-hmm.
What has been very gratifying to see, however, is the wonderful heroism of young physicians, especially in the emergency room, but also inpatient ICU, all over the country, very much so in New York City. We've had a calmer version of that, but not without our own little fears and panics as it went on. Overall, I'm reassured that we're in good shape, but very worried and feeling some survivor guilt looking at my colleagues in New York and elsewhere who clearly need more help.
Mm-hmm. That's very true. That entire picture that you just painted. You mentioned the AIDS crisis, and I know that you have said that this pandemic carries echoes of that crisis, which was really just beginning in the early to mid 80s when you were a resident, and which you've written so beautifully and powerfully about in My Own Country. And you've referred to the AIDS epidemic as a litmus test for medicine. And so I want to ask you, what, how is COVID-19 today providing a different sort of litmus test for medicine?
Yeah, I think the big difference with HIV was that it began with groups who were already marginalized, people like the gay community, IV drug users, who society already had great difficulty coming to terms with. And so, the attendant fear that went along with AIDS was also very easily directed at this particular group. And unfortunately, in that era, the litmus test, when applied to medicine, didn't portray us very well, because there were many who said they want nothing to do with this. And I mean, I even had radiologists tell me when I was showing them an X-ray on a patient with HIV who I wanted some guidance on, I'd have them say things to me like, "Why are you taking care of these fags? They're going to die anyway." And when I tell that to my medical students now, they can't imagine that there was an era or a sentiment like that. And I think what has changed is, for one thing, people are less willing to say things like that, even if they feel it. But I also think that this virus has been so democratic in the way it attacks just about everybody that I think there isn't room for that kind of maneuvering and scapegoating, even though God knows people seem to be trying. And I would say that the litmus test, when applied to medicine, has been dramatic in terms of being wonderful. I mean, I can't imagine of a more heroic response by frontline medicine. And you see that in the way the public thinks about medicine. I'm not sure that we were always looked at with the same rosy view.
Applauding public health workers as they go to the hospitals at 7 p.m. in New York City, for example, in the evening.
Yeah.
It's amazing.
It really is amazing. So I think medicine is really, as a litmus test, we've come through with flying colors. I can't say the same is true of the way the institution of, the big institutions of this country have responded. There's been a lot of, back and forth and disinformation that are just not helpful at times like this. And it's been interesting to watch, in a way, science getting pitted against politics. And you would think that there'd be no room for that, but it's absolutely what's going on. It has echoes for me of Camus. We're both reading The Plague right now.
That's right.
I've always loved that book, but
yeah.
A line in there where he says that both good intention and evil intentions are often based on ignorance, and that is the case here, where a lot of ignorance drives bad policy, and we should be using science more than anything at this juncture in our time, in our history.
That's what science is supposed to do. My next question is about another side of science, in a way. Your particular specialty as a physician is the practice and teaching of bedside medicine, a phrase I've always loved. And it places primary value on the intimate connection between doctor and patient, and the empathy and close attention required on the doctor's part to fulfill that deeply human obligation. So I wonder, at this time, when a pandemic like this, when there can be no intimacy or touching, in intensive care wards where people are suffering and dying and need it most, how does bedside medicine live and do its job? And how can you make that happen in such difficult circumstances?
Well, it's truly challenging. I mean, because even before we had this epidemic, anytime you have a patient in isolation for whatever reason, and you walk in there gowned and gloved, you just sense that there's a level of connection that you can't quite make, because they can't see your face, they can't see your expression. And I think the bigger issue in the ICU is not that we can't touch or see them or examine them and all those things. We simply can't do it as often, because there's such a rigmarole in terms of what you have to do to go into the room, that you have to try and be economical in how many times you go in there. But I love the way that people are, resorting and discovering, ways to make this more humane and human. For example, there are many healthcare workers who print a big picture of themselves on a printer, and then stick it to their yellow gown, so that
Really?
the individual, that actually began here, so that the individual can, see who this person is they're dealing with. And then
Right.
the other thing we do in our ICUs, we have iPads for every patient, so that there's a lot of exchanges that can take place just as we're talking right now. And I think we're all discovering that there were a lot of in-person things that we didn't absolutely need. But you're right. I think if we're relegated for a long time to come to only interacting in this fashion, it does pose some challenges, but it's not impossible. We can touch, we can do everything we used to do. It's just that we're garbed in this fashion that makes it a bit cumbersome, to say the least.
In many cases, right now, medical professionals tragically are taking the place of family members at the bedsides of dying patients. Family are not allowed to be there very often. So on top of that, we have this sort of existential, grief and shock that, is across humanity, experiencing across the globe in a sort of more existential fashion. So as a doctor, how do you see your role in helping individuals and society deal with this amount of loss? And what do you say to your residents and the medical students you're training and have trained, some of whom are going right into the trenches, months early now?
Yeah, I think it's been very hard to see so many people having to die alone. Even if there are people there, the barriers of gowning up are such that the family aren't there, and very often their last words, their last moments are unwitnessed. They're completely alone, and that is really tragic. That really breaks my heart. As I said, I think we're doing our best to circumvent that as best we can. And part of the problem is the lack of personal protection equipment. If we had more PPE, as we call it, more of it to go around, I think we could certainly envisage being a little more relaxed about allowing family members in, because that's such a vital moment. The brunt of care is being delivered on the front lines by emergency room physicians, by the young residents and interns in the hospitals that are teaching hospitals, but otherwise by frontline people, nurses and others, who are bravely seeing these patients. And I would say that the great majority of the infections that have happened in healthcare workers are related to massive exposure combined with a lack of personal protective equipment. So I really feel for the frontline physicians, but if you think about it, most of them are at grave peril largely because of the lack of preparation, not on their part, not their fault. And I feel terrible as a professor to think that we're responsible for that.
So I want to move a little more towards the literary now for a moment. It might come as a relief. But, a few, not many of our greatest writers have also been physicians or were physicians. Thinking particularly of Chekhov, Somerset Maugham, I know a great favorite of yours, William Carlos Williams. And I wonder, what do you imagine they might have to say about what we're going through now and how we're doing? And also if there are any books in particular you think might have special relevance or insight for us at this time.
Yeah, it's an interesting question, I must say, and I'm honored that you mentioned me in that August company. I'm not sure I deserve that.
It's good company.
But I've been reading Camus' The Plague, and it's astonishing to me that this layperson sitting in a room in Algiers, I believe he was, in Oran actually, which is the setting for his book, could imagine all these things in such incredible detail. I mean, page after page, you run into a particular emotion, a sentiment, or a description of the way societies are reacting, good or bad, that is so prescient and so very apropos of exactly what's going on right now. But I've always thought that, what is medicine but life plus, if you like? It's life at its most acute, at its most lived moment, if you like. And so there's a lot of that going around. It's been, I think very interesting to see how it plays out in the ICUs, how it plays out with families, but also how it plays out in my neighborhood, to see people stepping up and taking care of each other, others, becoming quite, if you already have a germophobia, this is a very awkward time to have that.
It is.
It's protective in some ways, but it's also very awkward. So I don't know that I have finished digesting what this all means. Right now, I don't know if you know this, John, but when I first came to this country, I came because my medical schooling was interrupted by war in
I
Ethiopia.
do know.
I landed in New Jersey, and my very first job was in a nursing home in New Jersey. And my first exposure to American medicine was to see the warehousing of older people in nursing homes. And it was a shock. I mean, it was a beautiful setting outwardly, architecturally, and, just compared to what I had ever seen before. But to think that all these years later, it's almost 40 something years later, that the nursing home has remained frozen in time while hospitals and medicine have evolved. And in fact, I was able to even find online the very nursing home that I once worked in and look at its interiors, thanks to the web. And, I'm very, very concerned because that huge population of older people in nursing homes, they are like on a cruise ship. The analogy is absolutely appropriate. They're confined to one space. They share dining and recreation facilities, and they're cared for by a very small crew that has intense hands-on interactions with them. And so for a few weeks now, I've been really terribly worried about the nursing home situation, trying to write about it, trying to think about it. And I'm hoping that it actually forces us to reconsider not just how we run nursing homes, but also how we care for the elderly. I think the measure of a society is how we care for the elderly.
These are not just medical problems or even public health problems. These are the results, it seems, of decisions that our society has made in different ways. The prisons are another element of this.
Yeah.
I mean, when I think of you also, you're one of the most humane people I know. And so this, in a way, leads into my next question, which is, as long as we've known each other, you have been leading this double life, toggling between medicine and literature. And, I guess my question is a sort of simple one, how hard is that? And, as a fellow writer who's not a doctor, and I mean, how the hell do you manage it, honestly? And, in what ways do you think, would you consider that those practices in some way sustain and nourish each other?
Anytime I'm asked that question about, these two hats, I always feel like I'm not really wearing two hats. And I know that the more I say that, the less, I know that it's actually not accurate that I am actually a writer, but the hat that I embrace, that I only see myself as, being all physician. And to me, the writing comes out of that in some way. Other people have their golf or they have their research lab, and I have the writing as a way to process it. So I don't see them as two completely different hats. And, the most important way that medicine impacts the writing, I think, is that it informs it, gives it a method. I think I'm always sort of looking at human beings first in terms of what the body is showing, and then secondarily their motivation. But the other way it impacts it is that I'm a much slower writer than you, for example, or take Joyce Carol Oates. She's probably written a novel since breakfast this morning, and while you and I were talking. So the pace of what I write has been, slow to evolve. It's not something that I've worried about too much. I think my publishers worry about it a great deal more. So I write when I can, and I've been really blessed to have more time, paradoxically, during this shelter.
Well, right now you are not only at the hospital, but you are in all the rest of the hours of your day. You are putting, finishing touches, if you will, on this novel, The Covenant of Water, that readers will be thrilled to hear is coming out next year. And I know what a long journey this book has been for you. And would you tell us a little bit about it?
No, I'm happy to talk about it. And it's funny how, even though the book is set in a different time, beginning in the 1900s, and with sort of different medical issues that I'm bringing up in the novel, as I said, I think it's all back to life plus. And, what is life but our loves, our great conflicts, our desires to get past them, to resolve them. So there's so many echoes of what I'm working on in the book with what I see every day. The book, in short, is set in Kerala, which is where my parents are from a small insular Christian community that believes that St. Thomas the Apostle came and converted the locals to Christianity. And, they've remained a very intact community. The only novel that I can think of that most people would know, set in that very same community, is The God of Small Things by Arundhati Roy. It's just down the road from where I set my novel. And but the great conceit of the novel is that there is a condition that runs through the family of familial drowning. There's one member of every family, of every generation, and several members sometimes, who drown. They drown in ponds, they drown in bathtubs, they drown anywhere. Something happens to them with water. And in fact, the title of the book is The Covenant of Water, which is a change. You've been listening to me about this book for so long that you've
I love this title. Yeah.
You've watched it change its title. But I must say that during the AIDS era, I was writing Cutting for Stone, which took several years, and I think during this era, I've been writing this book, The Covenant of Water, all through the SARS epidemic, the MERS epidemic, and now this SARS-CoV epidemic. And I find that they're great parallels. I mean, the nature of human beings is that we're vulnerable. Perhaps the most striking thing to me is this dichotomy between what we know and yet our inability to follow what we should be doing. It's almost as though we can hear the great waterfall coming up. We can, we know this is the best time to swim in the other direction, but some, inexorable impulse draws us into the storm. That makes for great storytelling. It also makes truth of what we see in life, where sometimes we can't help ourselves. We're our worst enemies.
Human nature and its contrary impulses.
Yeah.
And of course, stuff of great fiction.
I also think that it's another illustration, if I may,
yes, please,
of the parallels between life and the novel. I always think that characters are, best defined not just by their description or their appearance and their family setting and this and that, but by the decisions they're forced to make under pressure. And you look around right now, and there's a lot of big decisions we're all having to make, the government's having to make, and it speaks volumes about character to see the way people are responding under pressure. I mean, I'm thinking about my house staff. They're so young, but the way they responded is just the level of maturity and the depth of character that reveals is profound.
They will tell themselves things about themselves.
Absolutely.
As they go forward. Yeah. And I think in other cases where perhaps at the macro level, the pressure has been too great for certain people, that will also, those are character defining moments as well.
Yeah, very much so, very much so. I mean, it's been hard, but I think clearly, your character is defined by the things you do, and it's been interesting to watch.
So as writers, and this is sort of leading to, the end of this particular talk for you and me, but I know just personally speaking, not being on the front lines, not being a physician or a first responder or anything like that. And I find that in these last weeks, I've been really struggling with my imagination feels flattened by almost beggared by the reality that's going on. And it also all too often in the middle of the night feels irrelevant. The things I'm thinking, I would be thinking about or would be wanting to investigate imaginatively as a writer. And so I wonder you and I have discussed this at different times over the years, but right now, what role in your mind can art and works of the imagination play, especially for people in time of crisis? What is it about connecting with certain works and that compel your imagination forward, compel you to engage with things that are not happening right now, but nonetheless are about people and how they live and die?
Yeah, I think that's a great question. I think the thing that strikes me as being affirming for books and the things that you and I do is the fact that people are now at home and there's so much information coming at them, and most of us have this compulsion to track the news every 10 seconds, and I think it's doing a disservice to our minds. And it's so refreshing to see, I mean, globally, but I mean, I'm reading this in many different places, that people are gradually learning that it's not healthy to be looking at the news that often.
Yeah.
There isn't that much changing every 15 minutes. And my own sense is that, I'm discovering that for my sanity, I need to check the news, once or twice a day, the major global news. And there's other focused reading I need to do. But my escape is to pick up a book. The novel is the great lie that tells the truth about how the world really lives. And I can learn a lot more about this plague by reading Camus or reading Dostoevsky's The Idiot, which is another book that I happen to be.
Have you been rereading that?
I've been rereading that, and I'm on a Dostoevsky jag right now. And, I think the profound thing about him is his incredible sympathy for every character, even the most evil person in there, has this, very human element. And it's made me more, I think, compassionate and forgiving of some of the idiocy that I see around me. But it's also very affirming about life, coming back to books. So it's a, in its own way, it's a special time to renew the faith in literature, in art, which is what gives meaning to our lives. But it also, in the manner that we're just doing, it really highlights the importance of connecting and communicating, the human connection. Ian Foster said so long ago, only connect. And, the profoundness of that advice now that we're all unable to connect in quite the way we're doing is truly profound. And I just want to make sure that I convey to you and to the listeners that, I am certainly not in the front line in mass all day. I've had a lot more involvement with the logistics of organizing and, getting this response ready and changing your whole, education and medical care delivery to the mode we're now engaged in. Has taken a lot of legwork. And I'm just in awe of the variety of human beings and their talents and how they come to fore under stress. But I could have, I suppose, been well aware of that from reading enough of Dostoevsky or reading enough of Gabriel Garcia Marquez. I mean, there's abundance in the literature to inform us as we deal with this problem. And I'm rejoicing in the small things like that.
That is a wonderful place to end. You have made my day much better. I can't thank you enough. And I'm looking forward to raising a glass to you tonight from across the country.
Well, let's do that. We'll raise it virtually.
All right. Take great care of yourself, and we'll talk soon.
Thank you so much, John. Appreciate it.
Okay.